Atrial septal defect is a congenital defect that has opening or a hole in between the right and the left atrium. The hole increases the amount of blood flow to the lungs. Babies born with ASD have no signs and symptoms. We commonly identify the signs and symptoms to begin in adulthood. When assessing a client with atrial septal defects, we commonly assess the most outstanding sign, which is an exertional dyspnea or shortness of breath when exercising. Other manifestations include fatigue, swelling of legs, feet, or abdomen, tachycardia, skip beats, stroke, and murmur. A small atrial septal defect might never cause any problems. However, a large defect can lead to right-sided heart failure, arrhythmias, increased risk of a stroke, and shortened lifespan. The specific cause of atrial septal defect is unknown, but these factors can be related to genetic factor, like Down syndrome that runs in the family, maternal factors such as rubella infection during pregnancy, drug-related use such as tobacco and alcohol during pregnancy, diabetes, and lupus. What are common diagnostic procedures that can assist to identify atrial septal defects? 1. Echocardiography to identify the presence of heart murmur. 2. Chest X-ray to identify the conditions of the heart and lungs. 3. Electrocardiography to identify the heart's electrical activity and the presence of arrhythmias. 4. Cardiac catheterization to identify how well the heart is pumping, to check the heart valve function, and measure blood pressure in the lungs. MRI and CT scan are used to identify the heart's images if echocardiography is not enough. Many atrial septal defects close spontaneously. Medications won't repair a persistent atrial septal defect. But what medication that can help the client to reduce the signs and symptoms and its possible complications? This may include the use of beta blocker to regulate the heartbeat, anticoagulants to reduce the risk of blood clots. Surgery is not recommended if pulmonary hypertension is present, since it may worsen the condition. What surgical procedures are appropriate to a client with atrial septal defects? 1. Cardiac catheterization. Through this catheter procedure, surgeon places a mesh patch or plug to close the hole. The heart tissue grows around the mesh, permanently sealing the hole. 2. Open heart surgery, where incisions in the chest is made and doctor will patch the hole. Let's try to find out whether you've learned from this topic. Let's have a sample question. Which of these statements is correct about atrial septal defects? 1. Atrial septal defects newborn manifest signs and symptoms. 2. Small defects can lead to stroke. 3. The cause is specifically related to Down syndrome. Or 4. Large defect can lead to right-sided heart failure. The answer is 4. Large defect can lead to right-sided heart failure. Number 1, remember that signs and symptoms can begin in adulthood, not seen on newborns. Number 2, large defect, not small defect, can lead to stroke. And number 3, the specific cause is unknown. It's not specifically related to Down syndrome. So the answer is definitely 4.